Hey, welcome back to America's Healthcare Challenge. In our last segment, we talked about the rate increases in the Affordable Care Act market and how they are going to affect everybody and how those change every year and each state is varied. And along those lines, I wanted to talk about a story that has been on my radar for quite some time now. And that is the failure of a large individual health insurance company named Bright Health. They also do business under another name, which is called, let me just look here, it is called Friday Health Plans. And they have recently gone belly up, and it is having rippling effects on the insurance marketplace, especially in the ACA marketplace. And so I wanted to take some time to go through a story that I saw today in Fierce Healthcare and talk to you a little bit about some of the impact of what has happened, what this could mean, and what it could mean for you if you're in a state that Bright Health was in. And I don't know that they were in all of the states, but they were in quite a lot. So I'm going to be reading to you from the story by Frank Diamond on August 16th. Bright Friday, that's those two companies, could cost other payers, so that'd be other insurance companies, $1 billion in risk adjustment payments, according to experts. And the collapse of InsurTech's Bright Health and Friday Health Plans might mean that legacy insurance companies, health insurers, where they operated would not receive up to $1 billion worth of risk adjustment transfer payments. And this, according to an expert that follows the industry. So this could really affect people that are in Florida. So Florida Blue Healthcare Service Corporation, Medica, which is actually a company I'm on, they have a presence in the Midwest. Centene and Molina Healthcare, who might have to pay the price for Bright's and Friday's overreach. And we're going to be trying to get an expert on that. This is according to Ari Gottlieb. We'd like to get him on if we could to talk about this. And he said, Mr. Gottlieb said, quote, "We are continuing to see impact of reckless growth at all costs approach of venture-backed plans, Bright and Friday." So they were basically insurance companies founded by venture capitalist companies. Maybe didn't have an idea how to run the business, but they've already caused members, and I've had to help people make these decisions. They've had to pick new coverage. Investors have lost billions. And now these other insurance companies are left holding the bag and maybe not be getting these certain payments from the federal government. That's what this is. The federal government, under the law, essentially pays for certain high cost individuals, and it pays these insurance companies as kind of like a reinsurer. Now, both Bright and Friday have been forced to exit the individual insurance market. And under the ACA, risk adjustment in individual plans is transferred to other plans at the end of the year. The idea being that financially better off insurers can help struggling insurers who may have the larger population of sicker members. So, what that's going to mean, probably, because, aside from giving themselves large bonuses as executives, in general, when insurance companies are forced to take on new costs, that usually means you, the consumer, ends up paying for it in the end. Now, according to Gottlieb, while Bright is telling states they will ultimately pay, given the company's track record of accurately forecasting their capital availability, other high plans should probably treat that with a high degree of skepticism. Now, this kind of all started in Texas. There's a recent filing. Bright said in its most recent SEC earnings report that it does not plan to pay its entire risk adjustment liability. What that means is it's going to go on to these other insurance companies, it looks like, at this time. And, that's because Bright has lost $16 million. Its Medicare Part D plan, $15 million below capital levels. Again, folks, this is why if you watch our videos before, we talk about how important it is to look at the financial history and financial ratings of these companies, because here's an example of a company that doesn't have enough money to pay its Part D claims at this time. What ultimately darkens their future, according to Gottlieb, there's a thing in the Department of Insurance in North Carolina as well. And they were owed another $60 million and about $6 million in unpaid claims. So there's going to take a while for this to sort out. But if you're living in the states where I mentioned some of those other insurance companies, we've talked about how the rate increases come out each year, and they just came out for next year. Be watching 1 year from now, and we'll see what the impact of this Bright debacle has on the individual market in your state. And I can tell you we will be planning to watch that very closely. We will continue to watch this issue, and we'll be bringing right back with more information on what you can possibly do if you need to fight back for a treatment that you should be getting and are not because the insurance company is saying no. You're listening to America's Healthcare Challenge. Check us out online, facebook.com/America's Healthcare Challenge. We post YouTube shorts. We've got a YouTube channel as well. All kinds of tips and information for you as we navigate these complex waters of the U.S. healthcare system.